Hello everyone, I'm Dr. Dmitro Klokal. I'm the head of Medical Advisory Board and Chief Medical Director for European Wellness International Group, which is a network of medical and research facilities dedicated to anti-aging, longevity, preventive and biological regenerative medicine. And in this video, I will present to you some very new and very important data regarding the coronavirus COVID-19 pandemic. I'll try to make it simple in a bullet point form and just free and easy. So, as we all know, although the majority, some 80 to maybe 95% of cases are either asymptomatic or have a mild form of the disease, the remaining patients have severe or critical form of COVID-19. And most of the common symptoms of the COVID-19 include fever, fatigue, body pain, cough, shortness of breath, and some intestinal symptoms such as diarrhea, which may occur in about 20 to 25% of cases. In addition to that, patients who have severe or critical form of COVID-19 disease, they may develop pneumonia, acute respiratory distress syndrome, sepsis, multi-organ failure, which in its turn may lead to death. People who are at risk for severe and critical COVID-19 are those with underlying medical conditions, and mostly those are chronic medical conditions such as hypertension, diabetes, chronic lung or heart disease, and also people of the elder age or senior people. So those are at the top of the risk for the coronavirus and COVID-19. So now here is the data which was published in the Asian Pacific Journal of Allergy and Immunology just a few days ago. It's a review article titled Immune Responses in COVID-19 and Potential Vaccines, Lessons Learned from SARS and MERS Epidemics, which is written by the experts from Thailand, by the way, and I'm quoting this article. Coronaviruses employ multiple strategies to interfere with signaling leading to the type 1 interferon production. And as you know, the interferon is one of those vital biochemical substances that are something like a first line of protection, our protection against viruses and bacteria. Transmission of virus occurs even in asymptomatic infected individuals that may be indicative of delayed early response of the innate immunity. COVID-19 induces the delayed type 1 interferon and loss of viral control in the early phase of infection. And this is a very new data, by the way. In addition, no severe cases were reported in young children, we all know that, when innate immune responses are highly effective. These facts strongly indicate that innate immune responses are critical factors for disease outcomes. So let me explain this in simpler words. It's not only people with a chronic lung disease or heart disease or diabetes or hypertension or weak immunity, for the matter of fact, or just the old folks are at the group of risk for COVID-19. The coronavirus itself is capable of further weakening the immune system and evading or escaping immune defense mechanisms of the humans. This data matches with other facts, and for example, such as a report coming from Australia that was published 2 weeks ago in a journal Nature regarding a woman who came from Wuhan, was positive for coronavirus and developed COVID-19 disease. however, and I'm quoting the article, did not experience complications of respiratory failure or acute respiratory distress syndrome, did not require oxygenation, and was discharged within a week of hospitalization. What doctors in Australian hospital have found out is that she had a good immune response, high amount of immune cells and antibodies before the resolution of symptoms. Now, here are some more good news for you. As probably you know, well, and if you don't know, I'm going to tell you that immune system consists of many types of immune cells and various defense mechanisms. Each one of them is doing their own work, and all together they protect our body from infection. It is important to understand that the very initial stage of viral contamination, and it's especially applicable for the case of the coronavirus and COVID-19, define the entire course and outcomes of the disease. If you can strengthen your immune response at the very moment or even before virus invades into your organism, you have high chances to have a mild form of the disease or to have no symptoms at all. Years of clinical research and medical practice have proven that adequate doses of vitamins C and vitamin D may improve immune defense. And it is important to understand that we're talking here about the direct intravenous administration of vitamin C or the injections of vitamins D in the high doses, in the doses which are adequate to perform a proper function or increase your immunity. And those doses are quite unlikely to be effectively achieved with normal food or just normal regular vitamin or multivitamin supplements. Plus, these essential vitamins, they have to be given in a specific form and according to a specific protocol that will ensure the maximum bioavailability and high absorption rate of these substances in your body. Next, hyperbaric oxygenation and intravenous ozone therapy. They both work synergetically, and each other and all together they provide an effective protection against infective agents, against viruses and bacteria. They also boost your immune system and they improve your antioxidant protection. IV ozone was first introduced during the First World War in medicine as the antimicrobial agent. And hyperbaric oxygenation is well known to increase the oxygen supply to tissues, to trigger your antioxidant protection, and also to boost our immune system. All these treatments can be effective when they're given all together and not separately one by one, because it is vitally important to stimulate all lines and mechanisms of immune defense. Together with other specialized treatments targeting our cells of innate immunity, such as transfer factors that increase the NK cells, or stimulation of monocytes and macrophage activation, NIC and other treatment modalities restoring our immune system and hence protecting from severe infections. It is important to understand that if you want to effectively increase your personal protection from infections, all these measures should be taken, combined, all together in the proper form, following proper medical protocols, and must be given by medical professionals. Now, where can you do it and who can do it for you? The great news is that European Wellness Villa Medica Clinic in Bangkok is the place. It is the safe place, a place which is a proper medical facility observing strict hygiene compliance, infection protection and control measures, where all necessary treatment modalities that you need to boost your immune system and protect yourself from COVID-19 are available. European Wellness Villa Medica Bangkok Clinic offers proprietary therapies and services specially created to enhance and support your health in a fight with pandemic. So please visit European Wellness Villa Medica Bangkok Clinic for your personal protection. Stay calm, stay healthy, take care of yourself and others, and together we will overcome this pandemic.